We would want to confirm that the number of persons who have tested COVID positive in the last few days has continued to go up, and that remains a big concern to us as a county, given the circumstances in which we find ourselves, especially being among the one of the 5 counties that are under the lockdown. We therefore think that it is important that the public adheres to the Ministry of Health protocols with respect to restriction on movements, wearing of masks in public places, sanitizing, and all the other things that we've been saying over time. But beyond that, we also want to confirm that some of the patients who have later turned positive have come with very different symptoms from what was previously there. And therefore it is important that the traditional temperatures high, that is what we really told the people, that if the temperatures are high, no, you have it. But the symptoms now are a bit different, and therefore it is important that there is a clear public awareness on this area, because if they are not able to identify the early symptoms, then we have a problem. And in many of them, temperature is probably not the issue. It could be a sore throat, it could be what looks like any other flu, and therefore when they come, it becomes a little bit late. We are also of the strong view that there are various variants that are said to be in the Kenyan space. The South African variant is the British one, and many others. But our current testing only goes to the extent of confirming whether you have COVID or not. It does not give us the benefit of what of the variants you have. And therefore that also limits the information available to us and the possibility of a more precise intervention when it comes to treatment. So I think working together with national government and other players, there is need for us to have better testing, better equipped testing, so that we can have precise knowledge of the exact variants found in whatever spaces, areas for that matter, and how we can be able to deal with it. And therefore our plea for now, the system of testing is purely whether you're COVID positive or COVID negative. And that we believe is good, but not good enough, given that the different variants have different characteristics. And in particular also to note that the people who have been sick in recent days have shown totally different symptoms. The severity has been very high. We have also seen age groups that were previously not a major threat now being under very serious threat. And the time it takes to get severe also has reduced. And also the level and degree of severity and fatality has equally gone up. So I think it's also important for us to document this so that we also can look at this vis-a-vis what we already have. As a county, we have also been under immense pressure. The first pressure arising from high number of persons confirmed positive, and therefore needing medical attention, and therefore our hospitals are largely overstretched. And in the last 3-4 days, it's also good to confirm that we've not had one single ICU bed available for persons in need of critical care. And we've had to take some of our patients out of Nakuru, but the truth is even they will soon be overrun. So again, as a county, we are trying in the short run to see how we can increase our bed capacity by about 50%. So we will be working on that in the coming week. And also to get personnel to run these ICU facilities. As we all know, we require personnel with very specific training, ICU nurses. And from next week, we'll also be recruiting them so that we can increase our capacity, especially at the ICU level. We are also working with the private hospitals. They've been of immense help because health has no borders, and a lot of the patients who can afford and have gone there have also received immense care. But one area that we will require to work closely together is also the expansion of oxygen supply both to our public hospitals and also to the private hospitals. And in connection to this, we are already in discussions with the Ministry of Health at the national government, and we have appealed for more support so that there's more oxygen available and that we do not have situations where there are delays in availing the oxygen. And therefore, on this, we want to take this opportunity also to request the national government, the Minister for Health, that this pandemic is a national pandemic. The counties affected may vary due to severity, the nature of economic activities, geographic location, and rate of urbanization, among other things. But nevertheless, it is a national pandemic. And therefore, we believe that the state must also consider areas in which we can partner so that citizens do not suffer because of unavailability or inadequate facilities for provisions that would otherwise have been dealt with if there was better planning. So we'll be engaging also together with the other 4 counties to make sure that our healthcare facilities are not overrun, and I think also to urge the national government to do all that is within its power to also give a rescue package to these counties so that we can all work to save lives and also to help in the prevention, because also prevention must be a very critical aspect of this entire campaign. Lastly is also to say the containment measure within the 5 counties may have reduced movements from outside, but within the 5 counties, the movement is still very high. We believe that may be also a major contributor why the numbers still remain high. And I think in the days to come, we may seek a review, given that the nature of this disease is that it cannot travel on its own. It requires a human being to act as a carrier to the next gathering and so on and so forth. So as long as there are huge movements of persons from one end to the other, then we are bound to see more of these infections going on, especially in the days to come. So I think in the next 7 days or so, we should be doing a review to check whether the one block is working or whether there should be an individual county-specific sort of lockdown, given what we have. And just to confirm, here in NAKURU, almost every other day, in every village, back even in the very remote places, we have lost a person. Sometimes old people, middle-aged people, and that loss is very huge because some of them are very critical members in the society and their contribution will be missed by all of us. So we want to urge for cooperation, for county governments to work closely with national government, and also for the public to adhere to the public health regulations, and not just to wear the mask because the government or the policeman will arrest you, but because you know your life depends on the actions you take. Thank you.